So good morning and welcome back. As I said, I hope everyone had a great networking session and is prepared for session 2. My name is Kim Webb. I serve as the director for the Relationship and Sexual Violence Prevention Center at Washington University in St. Louis. I also serve as the ACHA president-elect, which I'm super excited about and really glad that you're able to join us here today. It is my privilege to announce the second session. And I really think that this session is not only timely and important, but it really gives us pause for thought as we consider the mental health and well-being of our college students that we serve. I would like to introduce the session after the tragedy, surviving a mass tragedy on college campuses. In an age where active shooter scenarios on school campuses is seemingly very common, dealing with the grief and trauma of these types of events is needed and necessary. This session will explore some steps to assist with surviving a mass tragedy. Again, I think this is so timely and so important, and so it is my pleasure to introduce Dr. Robert Jones from UNC Charlotte, who serves as the medical director for the Student Health Center. Dr. Jones.
I want to first thank ACHA for the opportunity to come and talk to you all today. I agree this is a very timely and salient issue for us. Shots reported near Kennedy. Run, hide, fight. Secure yourself immediately. That's the text I got on April 30th. And I'm seeing patients at the health center. There really has not been a day since that day that April 30th hasn't come up in a conversation, that we haven't talked to somebody about it. It hasn't come up in a meeting, that you haven't thought about it, that we're planning for the school year, that's not a salient issue for us. The next day, May 1st, the Charlotte Observer had a quote, open quote, "The reaction on campus was one of grief and fear and trauma, but it was not one of shock. It was only a matter of time," close quote. And that article was based on interviews that they had done with students that had been there, some in the same building, others that were on campus that evacuated that day, where they talked about becoming sensitized to these types of stories because they were happening so frequently. So in the research that I did immediately after this to try and find out just how frequently this happens, and unfortunately, there's no real compendium of where this information resides or how it's defined, but in the best that I could put together, there have been 38 or 39 shootings on college or university campuses since Virginia Tech. Virginia Tech was 2007, so 12 years, 38 or 39 since then. So indeed, it is becoming all too familiar to our students, and I'll talk about that in just a little bit. Wait a minute. So this is the event itself. This happened on the last day of classes at night, and so I'll talk about that in just a second. The campus was placed immediately on lockdown. The shooter was apprehended in the classroom where it happened, and so the immediacy of it all kind of got wrapped up by the police pretty early on. This is a picture of the Kennedy building. It's one of the original buildings on campus. Our campus is a young campus, but one of the original buildings on campus. It's a small building, but it's in the center of campus. And so one of the, oops, I went too far. somewhere. I'm missing a slide someplace. There we go. What I would just determine these as saving graces is that the shooter stopped, emptied the clip, dropped the gun, sat down on the floor. Did not try to escape. Because it was the last day of school, because it was at night, there weren't as many people on campus, but this is a building in the center of campus. So very quickly, this person could have left the building, blended in with everybody else, and would have been a very different situation. This is the usual, I'll put this in for completeness sake of your sort of outline of your emergency action plan. But what I'd say is the most important piece of this, if I can use my thing, is preparedness. Right? The initial response is the first minutes afterwards. That's the alert, the lockdown. The operational response is the hours afterwards. You put together the EOC and all the rest of that. But preparedness, I think, is the biggest part of this. And so in conversations that we had, and we had many afterwards, in a conversation with the director of emergency management, one of the things that I thought he said was so poignant and salient was, the plan is not as important as the planning process, right? So it's the getting together with your other stakeholders and other departments and having the conversation about what we will do if something like this happens. That really becomes the bigger issue as in terms of how you get things going for that. So what I'll try and point out for you is what I think are some of the issues that we have to consider, right? I do not stand here to tell you what the solutions for this are, right? But what do you do if this happens in the middle of the day? So for us, it wasn't a very busy time necessarily because it was the end of the year, but what if it happens in the middle of a semester, in the middle of a day, when you have a building full of students, and how you manage that? This, evaluating students coming to the door, we don't have a solution for that. I'll say very clearly. We have 100 different opinions about what ought to happen if somebody comes to the door, but none that we can all agree on. And so that's something we still struggle with, is what we're going to tell people who have now, gotten a text that says seek shelter immediately, and they go up to a door and the door is locked because the building, all the buildings are locked down, and they're banging on the door. What do they do at that point? So we have not solved that issue, but certainly something to be managed. What do you do with the folks that are there that have been seen or haven't been seen yet? And how are you going to manage them around? What do you do with students with disabilities? And so part of your planning process should be in conversation with your disability services folks. And then what became an issue for us a little bit was, how do you manage the staff, right? Because you have parents that have kids in daycare and other places who can't just stay there locked down for the next 3 or 4 hours. And so how do you manage some of the issues around that, taking care of others, which is what we're called to do, versus taking care of yourself and your family? The internal roll call is something that we didn't do, but I think is an important piece of this, because we have people out on campus all the time. Oops, it's my fault. I'm sorry. Yesterday, as a matter of fact, before I left, we had nurses out on campus doing flu shots in the union. And so we have people out on campus doing a variety of different things. And so being able to check in to make sure everybody who's associated with us is all right is a particular point of this as well. Return to normal operations, there won't be anything normal about what happens when you open up the next day. The next day, we took care of a lot of physical injuries. People got bumps and bruises and scratches and that from the scuffles of trying to get off campus, and some other mental health issues. There were some students that didn't want to go to the counseling center, and so showed up at our door at the health center. But I like this picture because for me, this is where the healing started. This was the next day, May 1st. It was a campus vigil. It was in our basketball arena, which holds about 9,000. It was full. And this was the after vigil, right? So after our formal vigil was over, this is what the students put together for themselves. That I believe is where things started where we all started to heal. So in the days, the night of, the CAP staff were in the student union seeing students, and in the days afterwards, not only were they in their regular building, which is right across the lawn from us, but also off campus. They set up an office off campus for students that did not want to or feel comfortable coming back onto campus and that was set up for, it happened on Tuesday, that was set up for probably the rest of that week. So that students didn't have to come set foot back on campus again because of that. The EAP, the CAPS did 600 sessions in that week with nearly 500 students. The EAP saw 360 of our employees in that following week. And so there was a lot of work to be done, and for folks that we put together a document that with information explaining post-traumatic responses and reactions and where the counseling resources were for students and faculty and staff, so they knew where to go. Since the shooting, these are some of the things that we have put in place or have happened. There was an internal review, which we did forever, it seemed like, for a few weeks, which was our after-action report, and talked about what things worked and what things didn't. And a lot of things didn't. The doors didn't do this, and the ID badges didn't do that, and all the rest of it. But now we're in the process of an outside external review. Reviewers, the National Police Foundation, and another organization that are doing that, to try and give us some more objective feedback about that. One of the things that came up was the broader active assailant training for campus. That's our ALICE training, and I'll talk about that in the next slide. The enhanced police response has been very interesting to watch, because I don't think that a year ago today the students would have responded to this in quite the way they have. So this is the police walking a beat, right? These are police officers, or our police and public safety officers, walking in pairs around campus. And you see them everywhere now. They're walking in front of the Union, they're walking in the center of our campus, there's a water structure. You see them all over. And I've asked students as the school year started this year how they felt about that. Did that made them feel more safe, or did it kind of wig them out? And uniformly, they said it was a great idea and they felt fine about it. That they were, that meant to them, and this is what a couple of them said, meant to them that the university really cared about their safety. And so having that presence around meant something. Unfortunately, we're in that group of folks now that we have metal detectors everywhere. Right? We have metal detectors at the baseball games and the soccer games and all over the place for the mass events, the football games and all that. And that's sort of the sad reality of sort of where we've come. These are some of the things that, operationally we sort of tried to put into place. The incident management team, which is the sort of leaders on campus, we're now doing FEMA incident command training, which that was part of the after-action report, was that there need to be more people on campus that knew what needed to happen in terms of emergency operations. And so now we're going through the 100 course and the 200 course and all the rest of that. So important. That increased active shooter training, this has not yet become mandatory. But I think that there's been lots of discussions about that. I don't know if y'all are familiar with ALICE training. If you do that on your campus, ALICE stands for Alert, Lockdown, Inform, Counter, and Evacuate. And so it is active shooter training for the campus. We've been doing this now for a couple of years, but at a campus of 29,600 students, we have a couple of thousand people trained. And one of the feedbacks that we got from the faculty and staff was that they didn't know much about what to do or how to do it. The students, on the other hand, knew exactly what to do, and they knew exactly how to do it. Because unfortunately, A lot of them have been doing lockdown training since they were in kindergarten. And I think that's a sad commentary. The Charlotte Observer identified a new moniker for that generation of students that we have now in our colleges, and they identified them as Generation Lockdown. Because they, after Columbine and with Sandy Hook and Parkland, that they really have, that's been what they've grown up with. Some of our freshmen this year were born since September 11th. And so that's what they've known. They've never known a time to go to the airport and not have to go through TSA or some of the other things that we now live with since that. And so we've talked about whether or not that needs to become part of orientation for them, but certainly orientation for faculty and staff on the campus as well. Increase the number of people who do the ACHA training, which we get that out a little bit more. And then creating zones on campus. So in a hazmat situation, you may know there's things identified as a hot zone, a warm zone, and a cool zone. Our campus is not laid out very well that we have this part of campus and that part of campus. And so what we're talking about now is identifying zones so that we could have people evacuate to certain areas, or we could clear certain areas to create more safe space for folks. In every classroom now, there's safety information that has the room number, the emergency contact number, and how to execute the directives: lockdown, shelter in place, and evacuate. The last part of the slide, the workshop for faculty and staff, this has been ongoing. So we spent a lot of time over the summer doing a lot of this training. It was, I believe, in certain ways, it was helpful. It was challenging, but it was helpful that this happened right before the end of school, because that gave us a lot of time to do a lot of training over the summer. Would have been a lot more difficult if this had happened on February 20th, right? And it was right in the middle of a semester where people came back. Now, I think it would have been perhaps better for the students to have to come back and reconstitute in place with their friends and connections sooner rather than later. But because what happened after the shooting was that their final exams were canceled. And so there are students whose parents came that night or the next night and went home, and they were gone until August. Right? They were gone for those 4 months. And so preparing the faculty and staff for when the students came back was going to be an important piece of this as well. So that was put together by the Dean of Students Office, the CAP staff, and the Department of Safety and Security to prepare the staff how to have conversations with students, what to look for in a student who might be struggling, and then make them all aware of the campus resources that they have available to them. The other thing that we did, which has been part of the creation of this family, and I guess I should have said from the outset, we are the Charlotte 49ers. Our mascot is a gold miner. There are a variety of explanations of how we became the 49ers. I'll be happy to tell you offline. But that's what we live by. And so you'll see that our community is known as Niner Nation. And one of the things that I think, and why I say that the vigil really was the starting point of the healing, was to hear those students talk very poignantly that evening about what it meant to be a Niner and what Niner Nation meant to them, and how Niner Nation needed to be resilient and take care of each other in that process. I thought was incredibly inspiring. The chancellor very early on put together a Niner Nation Remembrance Commission to make some decisions about how we were going to memorialize this day and these people. And I think that process has also been healing for the campus. So these were a group of probably 15 or 20 folks. Some are campus stakeholders, some are community stakeholders, about what are we going to do with the memorials from that. There were hats and shirts and letters and poems and all kinds of things that were left. You can see on the picture of the Kennedy building and around on campus. How are we going to memorialize that? What we're going to do with the building. Small building, didn't have many classrooms in it, but it's one of the original buildings of campus. And so there was a little bit of pushback when it was suggested that perhaps we tear down the building and put something else in its place. And then imagine if this is the engineering building where it happens, or it's the College of Education building, or College of Health and Human Services building. Now, those are much bigger buildings with 50, 60 classrooms in them. Be much harder to take that offline. And so trying to decide what we would do with that building and whether or not we'd ever use it as classroom space again. Imagine if you're a student that goes back into a classroom in the Kennedy building again after all this. And then how do we memorialize the students that we lost, 2 were killed, 4 were injured, and how do we memorialize that day? Because for us, 4:30 is the way other people think about 9/11, right? And you hear that all the time on campus. The other thing is that we've put together a declaration. We are all Niners. And it's everywhere on campus. It's on banners, on light poles. It's the wristbands that we wear. It's the lapel pins that we wear. I was walking through the airport in Charlotte yesterday, and the big mural-sized pictures of things on campus with the tagline, "We are all Niners." And so the chancellor's goal was for that to be more than just a motto or a slogan, but it to be our commitment to the bright future of UNC Charlotte and Niner Nation. And so as we move forward with these things in place, we're not at an end point yet. I'm sure that if I were to talk to you all in 2 years, I'd have something a little bit different to say than I have right now. Next Wednesday is the 6-month anniversary of that shooting. And so we're still in the process of putting things back together, coming together as Niner Nation, but these are the steps that I think have really been important to help us do that. So what we talked about as a health center planning for students to come back in August was to be there and be prepared to care for them in whatever way they needed it, right? And so instead of saying, "Where were you on 4:30?" What we decided was that we would just encourage them to talk and just ask these questions. How does it feel to be back on campus? Have you gotten back to feeling comfortable again, right? And allow them the time to talk about that. Because everybody's going to have their experience in different ways, right? Some were back on campus for the first time for summer 1 or summer 2. Some didn't come back until August. And so it's being able to be available to them in whatever way they need you to be available, and then the consequent referrals that need to happen as well. I like this picture. This all happened 10 days before graduation. And in a very real way, the campus has really wrapped their energy around Niner Nation Rises, right? That after this tragedy, that we'll be stronger and work to support each other as we get back to that. And that ends for me. Thank you all very much for your attention.
Thank you, Dr. Jones, very, very much. We don't have too much time for questions, but we have a couple here queued up for you. The first one was, did you have to manage any staff that didn't want to come to work for fear of their safety? And if so, how did you manage that?
So that's a good question. We did not have staff that fit that category. I think that is challenging. Now, for us, it was a little bit different because it was the end of the school year. So there wasn't, and because finals had been canceled, there wasn't a lot of people on campus. So, I would argue that we didn't necessarily need our full complement of folks. If there were, we could have absorbed the fact that people didn't want to. But again, a little bit more difficult when you're in the middle of a semester. So I think that there has to be room for people to select not to be able to come to campus or come to work for some period of time after that. And I think there were services, counseling services through EAP that dealt with that, because there were some staff in other places on base. So staff that were in the hot zone that were working in buildings around where this happened, where I think that was an issue for them. And so I think having the counseling response be robust in that way, and I think we tried to do that, was having counselors on campus. The EAP counselors were on campus for a couple of weeks, and then they came once a week all summer long. And so if that wasn't something you were dealing with until July, there was still counselors on campus that could help with that. And so having a robust counseling response, I think, is the biggest part of that.
Great. Last question. What did you do with the items at the memorial, and how did you save them?
Oh, that's still in process. So we at our library, we have an archivist. And so there were the first step was where do we put this, right? Because there's some very sort of logistical issues around. Everybody wanted to help. Everybody wanted to send water. Everybody, like, what do we do with all this stuff? It happened on a Tuesday. The memorial things were added to all week long. It was supposed to rain on Friday night and that weekend. And so there was this, we had to make some decisions about what do we do. We didn't want it to just be out there and get damaged or ruined. And so what they decided was week by week they would collect those memorials, and we had a place that we store them in the library. And then the archivist, along with the Remembrance Commission, are making decisions about in what way that's going to be displayed. Is there going to be a display in a building someplace? Is there going to be something built for those things to be displayed? So those decisions haven't been made yet, but that has absolutely been part of the planning. It's very interesting to me that was one of the early decisions that was made about collecting the memorials and saving them from the weather and all the rest of that. So we have a process, and at some point there'll be a decision about where those will be displayed.
Thank you, Dr. Jones.
Thank you.
Many thanks to Dr. Jones for sharing lessons learned and points of consideration post-tragedy at UNC.